5-Minute Pearls for Clinical Practice. This is week number 3 on the principles of optimal teaching. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. This is the third in a series of episodes about teaching. What are the principles for optimal teaching? Today I am presenting 2 more of these principles. For many clinicians, teaching students and younger associates is a very important part of our careers, so we're spending 3 weeks discussing the best practices in teaching. In this episode, I'd like to review 2 more principles important to teaching: preparation and prioritization. The first principle is called preparation. This idea relates to many aspects of life, but is very important in teaching. To effectively teach a topic, we need to make sure that we are extremely well prepared for each teaching session. But sometimes we get busy, and sometimes it's very easy to simply assume that we know a topic so well that we can teach it even without any preparation. Even if you know a topic very well, I encourage educators to review the material to make sure that you're ready and prepared to present the information. Just because you know the topic really well doesn't mean that you have all of the ideas well formulated in your mind so that you can present the information in a succinct and organized manner. By preparing for teaching sessions, we can familiarize ourselves with all of the details and also organize our thoughts so that we can present the information in the most optimal way possible. So preparation is really, really important. At least spend a few minutes, if not an hour or 2, preparing for teaching sessions, reading through the material so that you have all the information at your fingertips ready to teach. Along with preparation for teaching sessions, we also need to be careful that we don't overteach. I know this sounds counterintuitive, but I find that a lot of educators overteach. They might present 30 or 40 or 50 concepts on a topic and forget that people just can't process that much information all at once. As educators, we need to prioritize what we're teaching. I've attended over the years so many lectures and teaching sessions where the professor or the teacher will throw so much information at us that we walk away really not remembering much of anything. So I encourage educators to think about what are the 5 or maybe 10 concepts that are most important in a given lecture or presentation, and try to focus on those key concepts. If you have 10 key concepts, for example, that you want to get across, but you present 50 total concepts in the session, the students will walk away and probably won't even remember any of the concepts because there were 50 concepts presented to them. Or they may end up remembering 10 concepts, but they may not be the 10 key takeaway points. If your goal is for them to remember all 10 of those concepts, then you want to focus and prioritize those 10 concepts. A good strategy might be to focus on those 10 key concepts and be sure to practice repetition, as we discussed last week. And then if you have time to go into some of the other concepts, then that's fine too, but make sure that the key 10 concepts are taught to your students. The key is prioritization and making sure that the students learn the most important concepts first. We present the key concepts and then we find a way for students to use the information in simple and complex ways. People tend to learn best when they use information rather than simply being told something. If I'm trying to explain a heart murmur to a student, I will describe the murmur to the student and perhaps diagram out the murmur on the blackboard, but ultimately students learn murmurs by hearing them, and then we can have a discussion about the sounds. They learn best by processing the information themselves and fully digesting it, and then having further discussion about the topic. So the second principle for learning that we're presenting this week is prioritization. Focus on the most important information and encourage your students to practice and process the information in as many ways as possible. I find that many instructors spend far too much time talking and too little time listening and allowing students to process information. As a teacher, talking is important, but we need to express the information to our students both by telling them the information and also showing them how to perform whatever skill we're discussing. By having them actually perform the skill that we're discussing, that's where the true learning occurs. We need to allow our students to practice the skills that we're teaching them. So in my case, if I'm teaching the students about heart murmurs, it is crucial that I allow them to listen to the heart sounds or listen to heart sounds on a computer program. And then the discussion will lead to reinforcement of the learning process. As the student is processing the information and practicing the skill, the teacher can then add in clarifying information, answer questions, etc., to drive home the key concepts. This style of teaching is what I call synergistic teaching. It is where we present information to students with a focus on prioritizing the key concepts that are most important, and then we also allow them to process that information through practicing the skills. This is how we get optimal learning. These two elements work hand in hand to foster an even higher level of learning. Synergistic teaching goes a long way to helping our students optimize and prioritize learning for long-term educational success. Preparation and prioritization, the two key concepts for optimal teaching for this week. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.